everyone, good afternoon. I am Riddhi Varia from All About Skin Well-Being. I'm sure all of you must be keeping good in health. We all know taking good care of your skin is very important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mucuses are diseases caused by fungus, yeast, or mold. Mild fungal skin infections can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Brinda Thangaraj, live from Trichy, to enlighten us on the topic on fungal infection. Dr. Brinda Thangaraj is MD Dermatology and Cosmetology, hair fall expert, and practices at Dr. Brinda Skincare Clinic. Today, Dr. Brinda will share with us on fungal infection. So, Doctor, today we are going to discuss about fungal infections, and for the same, I ask you one question: how to take care of fungal infections and how to tackle the same.
Hello, first of all, good afternoon to everyone. Thank you for having me in this show, all about skin well-being. Today we are going to discuss about superficial fungal infection. So, fungal infections are generally mycosis, so which can be like superficial or deep fungal infection or systemic fungal infection. So, today we are going to mainly talk about superficial fungal infection. So, once you feel that you have got some skin infection, the first thing to is to consult your dermatologist. So, don't go for any OTC product. Just go to a nearby dermatologist to get it diagnosed. So, just to tackle it, there is don't do any like home care remedies. There is nothing like this. It's a fungal infection, so you have to get it treated with your dermatologist. So what you can do is, like, once you feel that you get infected, so you keep your skin dry, and you have to avoid any friction or something like that, and you can wash your clothes separately so that you don't spread the infection to the other family members. Okay, so these are the things that you can do it at home. And so once you feel that you have got some infection, you come to a dermatologist and you get it treated. That is the best way to tackle it.
Okay, so taking care of all the infectious diseases which regularly for fungal infections, we need to separately wash our clothes and do some of the other things and firstly visit to a doctor. Thank you so much for the same. I have the next question. What is the treatment of fungal infection?
So generally, when we diagnose the patient in the clinic with a fungal infection, we give some topical creams, topical antifungal creams. So like imidazoles or azoles, like whichever is convenient for the patient, and depending on the patient, like depending on the age group of the patient. If it's a younger patient, we'll give them some azole creams and see. If it is a limited lesion, we treat it with only with the topical antifungal. If it is an extensive lesion, we give some oral antifungals like oral tablets for the patient. The treatment course is supposed to be like around 6 to 8 weeks. So if it is a very extensive lesion, we extend till 12 weeks. So depending on the area of infection also. So the fungal can affect from head to foot. So if it is a fungal infection of the scalp, if it is affecting your face, or if it is your hands or legs, or depending on the area, the treatment varies. So usually the treatment protocol is for 6 to 8 weeks.
Okay, so especially visiting a doctor, we can get proper prescriptions of what treatment should be taken care of and what kind of fungal infections we have. Okay, all right. What antibiotics treat fungal infections?
Okay, so antibiotics we usually give for bacterial infection, not for a fungal infection. So only the scenario is when it is superadded bacterial infection. When patient has fungal infection along with a superadded bacterial infection, we used to give antibiotic. Otherwise, there is no role for antibiotic in a fungal infected patient. We usually give antifungal treatment, not antibiotic treatment.
Okay. Okay, so all right, thank you. Which is the most serious fungal infection you have come across and you would like to share with our viewers?
Okay, so the superficial fungal infection that we are dealing with are not so serious. Okay, so the fungal infection, which is a systemic fungal infection, is a serious infection that has been taken care by the critical care patient. So that they usually the critical care patient or ICU patient, they get the superficial, so they get the deep fungal infection. So that has to be taken care by the physician. So the serious fungal infection, usually dermat, we take treatment, take care of the superficial fungal infection, so not the deep fungal infection.
Okay. What are the major areas a person can face a fungal infection?
uh, Major areas you are asking, is it?
Yeah. Yeah.
Okay, so the fungus can affect from head to toe. So the most common that we see is in the flexural area. So the groin, that is the bikini line, and the axilla under the breast. So those are the common areas that females get infected. So the scalp infection is more common in the children's, that is called tinea capitis. Usually it is occurred from the animals. So the face infection or in the beard area, usually men will get that is called tinea barbae. So sharing of razors like that, or if they go to a parlor or someone, like they use the same trimmer which is not sterilized properly, so they will get fungal infection of the face. In the beard area they will get it. And the other tinea manum is infection of the hand. So people like who got infected, if they get in touch with that patient, they can get a tinea manum if they have any injury in that area. So the fungus can enter through that minor abrasion and it will cause infection of the hand. And people might get in the feet, that is called athlete's foot. Tinea will get affected in the feet region. So patient will get tinea pedis. So like that, there is different type of fungal infection. Each area will have a different presentation.
Okay. Okay. Thank you so much, doctor, for sharing your views. And why does a fungal infection occur again and again?
Okay, so the first thing is the patient getting treated by a non-dermat, or a patient getting treatment from OTC product. So they'll start using a steroid ointment. So once they use steroid ointment, what it happens is initially patient will have that better feeling. The patient will have a reduced itching and the lesion will get subsided. But once they stop using that, or like after few days, the lesion will get exaggerated. So the lesion will become more reddish, and the fungus will more grow in that area. So that is the first thing. And the second thing is patient is not adherent to the treatment. The patient who are in irregular follow-up, so they don't complete the full treatment course. So when they do that, the fungus will become resistant to the antifungal medicines. So even if they are leaving a gap or a week or so, so that fungus won't respond to the antifungal that we are giving. So it will become resistant. So the third thing is the reservoir. The reservoir are not treated properly. The family members, if they are infected, so once a patient gets cured, they'll get the infection from the other family member who are not get treated, so who are not taken any treatment for that fungal infection. And if they are continuously washing their clothes together, and if they are sharing their clothes, if they are sharing their towels, so they'll get the fungal infection again and again. So now I feel the fungal infection, the recurrence of fungal infection, relapse is more common, and the fungal infection has become very pandemic. So patient has to strictly adhere to the treatment and strictly follow the instruction given by their doctors.
Okay. You spoke about something about a treatment called steroid. Can you elaborate more on it when a person is facing this antifungal infection?
Okay, so whenever patient has some rash, no, so the pharmacist or other doctors, like who are treating, like other medical doctors, like other than dermatologists, they give some steroid for all skin infection. They don't know how to diagnose it, so they give steroid ointment. Steroid is an anti-inflammatory and anti-pruritic action. So initially, patient will feel relief, like they'll feel the lesion has subsided. So they'll think this is a the treatment protocol. So they feel like continuing the same. So once they start using it for a long term, so they'll have lots of side effects because of the steroid abuse. Like
Yes.
there will be skin thinning, and I've seen lots of people with stretch marks in the flexural area because you are not supposed to use high potent steroid in all those areas. So you'll have dilated blood vessels. Patient may end up in having ulcers. The skin will become very thin. They can see some dilated blood vessels in those areas, and the areas will be always red and itchy. So, those can happen. So, whenever you have any infection, you just go to a dermatologist, nearby dermatologist, and get it diagnosed. Because once they start using steroid, the basic morphology changes. So, it's kind of difficult to diagnose also. That becomes a tinea incognito. So, if it occurs, the treatment is very difficult, and patient has to do some investigation. Basically, the skin fungal infection. So we are very experienced, so we know we can diagnose this by clinical examination. So once they use steroid, the clinical morphology changes. So it's difficult for a doctor to diagnose. So we do some investigation like skin scraping or skin culture sensitivity, like that. To diagnose the case. So it becomes quite difficult for a doctor to treat those patients who have used the steroid before.
Okay.
So the fungus will become more resistant, and the fungus will flourish in the steroid skin. So it's kind of difficult to treat those patients.
Okay, I seem to have, like most of the viewers have been questions about steroids. If a person is facing a fungal infections and they are treated with steroids to reduce their pain, but later on they have to visit a dermatologist or to find no other important things which has been facing through fungal infections, right? They have to consult a dermatologist. Do the doctors, the one who checks, if we visit an antifungal doctor and they let us know that we are facing some problems with antifungal infections and we are supposed to take steroids, and some bodies doesn't accept, in what cases we need to do that?
I didn't get you.
I seem to like there are some bodies, like some individuals who are facing antifungal infections and their body doesn't accept steroid treatments. What should they do?
So for fungal infection, you are not supposed to use steroid. You have to use antifungal. So antifungal topicals and systemic treatment. You are not supposed to use steroid. So steroids is strictly no in fungal infection.
Okay. All right. Thank you so much, doctor. And can we stop taking antifungal treatment if the symptoms get better than earlier?
No. The patient has to complete the treatment course. That's what we discussed previously. That's why the fungal infection comes back again and again. So that the recurrence of fungal infection occurs because the patients feel they think that it got resolved and they'll stop the treatment. It's not like that. So the fungus will be there in the skin. So they have to complete the course of treatment, whatever the doctor has prescribed. Because once you start taking the tablets, they will feel better. But the fungus will be there in their skin. So the reservoir will be there. We have to completely eradicate the fungus. So they have to complete the treatment course so that it won't occur again and again. Okay. So once they stop and restart again, sometimes the resistance can develop for the same antifungal. So we have to grade it up to the next antifungal. So which is difficult for both for the patient and for the doctor also. So they have to strictly adhere to the treatment course.
So this is a big note to all the viewers who are watching us. I seem like you have to complete the entire treatment if you are infected with antifungal. Doctor, can you tell me, like, can oral antifungal drugs be taken during pregnancy?
Yes, there are certain drugs that can be taken during pregnancy. So, but during the initial few trimester, we try to avoid giving oral antifungal. We try to manage it with the topical antifungals. So, during the last trimester, we can give some safer oral antifungal and topical antifungal also. During breastfeeding, also they can take some antifungal. So, there are certain antifungals that can be taken during pregnancy and during lactation. So before delivery also, the gynecologists usually, OGs usually get opinion from us, because if the fungal infection is there in the vaginal area, so during normal delivery, the newborn baby also can acquire fungal infection from the mother. And if she is having infection in the lower abdomen area, if the patient is selected for elective LSCS, low cesarean section, so patient has to get treated for fungal infection before getting surgery done, because it can spread. It can, when they are cutting the lower abdomen area, the infection can become invasive infection. So the patient has to get it treated before they are delivering it. And during lactation also, there are safer oral antifungal agents available, so that they can take the treatment. So the main thing is they have to maintain the hygiene, and any skin infection that can get exaggerated during pregnancy because of hormonal changes. So they have to get it treated, because the symptoms and the signs will be more during pregnancy. So because of hormonal imbalance, patient will have pruritic itching sensation, very severe itching sensation. So they have to consult a dermatologist and get it treated.
Okay. Thank you, doctor. What are the key points, the person who is pregnant, what are the key points we need to make a note to avoid antifungal infection in a pregnant lady?
Fungal infection. So main thing is like, they have to maintain a hygiene. So they have to take bath twice daily using a gentle cleansing bath, and they have to like take bath twice daily. So if when they feel too much sweating, they have to change their clothes. They have to change their clothes twice daily. When it is hot and humid, they can change 3 to 4 times. Like if they are working, or if they are too much feeling too sweaty, they have to change, because the fungus grows in that area, wet and humid condition. So they have to wash their clothes separately. They have to dry it in the hot sun. So if the climate is not very hot, and they can even iron their dresses, so then they can use it. And they can avoid sharing their clothes, so that they don't get infected. So they can keep their skin like dry, not to like when after taking bath, they have to dab their folds and all, so that it's not wet. So they can prevent the friction. So frictional areas and all, they can use some dusting powders, so to prevent the friction. And that's all.
Okay, thank you. Is it safe to take antifungals for a long time for pregnant women?
No, like we give only safe medication during pregnancy, that to the end of the trimester. So the safe medication they can use for quite some time till that lesion clears, maybe 4 to 8 weeks. After that, they can stop it.
Okay, thank you. Is there a way we can prevent getting ringworm in our feet frequently?
So what I said earlier, so first is hygiene. So don't share your clothes, and keep your folds like dry, not wet. And you can use a dusting powder to prevent the friction. And they can prevent the infection by avoiding sharing of towels and sharing of clothes, like that.
Okay. How long do we need to take antifungal medicines for general, any of the person, if it's a middle age group of 30s, 25s and 4 to 10 age group? Like we have kids, individuals might get antifungal infection. So what duration should kids have, the elders have, and the more elderly people should have medications?
Okay. So this depends on the site of infection and the severity of infection. So usually for kids, if it is a very limited lesion, 1 or 2 lesion, we usually give some topical antifungal agent and wait for it to get it resolved. If it is not resolving, then we go for some oral medication. So for middle-aged patient, if it is a very extensive lesion, we give treatment for 4 to 8 weeks. So it can get extended till 12 weeks. So depending on the area of infection, if the nail is infected, we give treatment for 3 months for the toe fingernails. For the toenails, we give treatment for 6 months. It's a pulse dose, like once a month, 10 days course. We ask them to take it. And for elderly patient, depending on their condition, like if they have diabetic or depending on the immunity status and other, we do monitor liver function test, renal function test, other hemoglobin and diabetic status. Depending on that, we'll give some treatment. And depending on the extension of lesion, if a patient has very limited lesion, we try to manage it with topical agent. So if it is a very extensive lesion, we give treatment for 4 to 6 weeks.
Okay. Doctor, we have some questions from our viewers participating online. We have a question from John Varghese, whose question is, how is skin fungal infection tested?
So we do skin scraping. So we examine under a microscope using KOH. Then we'll see what type of infection is it. Or if it is not responding to our treatment, if it is a steroid-induced modified fungal infection, we do culture sensitivity. So fungal scraping and culture sensitivity. So if it is a deep fungal infection, we do skin biopsy. So using that, we diagnose as a fungal infection.
Thank you, doctor. You have helped our one of the viewers to actually know about how it is tested. And we have one more viewer with one more question, that is Shweta. What feature of the are used to diagnose as infection?
What
feature of the fungi are used to diagnose as infection?
Okay, so depending on the skin lesion, like usually that's why it's called in colloquial term as a ringworm. So a patient usually will get red, round, scaly, itchy lesion. So that occurs most commonly in the folds or in the hands, in the feet, the face, scalp. So anyway, patient can get it. So if they like, usually the other arterial area is like red bumps. Usually it will appear and it will goes off within 4 to 5 hours or so. And if it is a persistent red rash, persisting for more than 4 to 5 days or week or so, you have to consult a dermatologist and get it diagnosed and treat it.
Okay. Thank you, Dr. Then we have one more viewer with question, that is Aman Jain. The question is, are there any lifestyle or hygiene changes actually his son is facing, my son should make to prevent future fungal infection? So Amal Jain has a son and his question is like, what lifestyle or hygiene changes his son should take to prevent future fungal infection?
Okay, so way to prevent is like they can take bath twice daily, use a separate soap for each one of them, and use a gentle cleansing soap. Then they have to change the clothes like 2 times a day, and change his underwear also. Like even in the cold climate or winter season also, they have to change their clothes, and they have to wash their clothes and reuse it. So if they are not washing properly also, they will get the fungal infection. If there is an infected person in the family, so they have to wash their clothes separately, not together in the washing machine. So they have to wash it separately, like for each person's clothes. Like who got infected, they have to separate it, and the person who are not infected, they can wash it. So separately they have to wash it and dry it in the sun and use it. If it is not very hot in their place, they can use an iron box and iron even the underwear. They have to iron it and reuse it. So that's the thing they can do generally.
Okay, you mean to say a proper care of every outfit, right from taking a bath to wearing clothes, and all the hygiene activities should be taken care to
Yes.
prevent the son of Aman Jain to avoid the fungal infection. Well, we have more viewers participating with a lot of questions. I think, Doctor, your information session has been very impactful to our viewers, and we have a lot of questions. And next we have Dipti, who has a question: what type of fungal infection do you suspect for a daughter of 8 years? So I think she has a daughter of 8 years, and she seems to like what type of fungal infection she might get to know for a 8-year child.
So they can get a superficial fungal infection occurred from the infected person maybe. So if she has any red rash wherever like which site, so depending on that we can treat. It's most commonly children will get superficial fungal infection from the caregiver, so who is taking care of them. No, so if they get infection, like they might get it from them. So let her check if there is any lesion anywhere. She has to consult a dermatologist to differentiate between the fungal infection or it is some other kind of eczema or allergy, something else.
Thank you so much. And we have Purvi Mehta, a viewer, who has a question. How can we determine the exact cause of fungal infection?
So the cause of fungal infection is yeast or mold. Okay, the fungus which is present everywhere in the soil or infected animals. So depending on the history, we can identify. Like usually we ask any family members has an infection, or if they have gone to some relative place or shared their clothes. So it's very common in the hostel. So where they put their clothes together for a laundry. So common laundry. The people who have infected also putting their clothes together, so they'll get infected. And the people who are going to swimming pools, so people who are getting infected in their feet, so when they are sharing the common bath, common toilets, like they can get the infection. So proper cleaning of those places, proper maintaining of those things, like can prevent these type of fungal infections.
Okay. What are the common cause of fungal infection, like which you have seen in most of the patients you have treated?
So the common cause is like I feel the hygiene, then the fluctuous area they keep it wet, and because of friction, because of like weight, obesity, they have like all the fluctuous area they get more of friction. Because of that, they people get infected, and people are getting infection from the infected person because of sharing their dresses or towels like that. That's what I've seen very commonly here.
Okay. Thank you so much, Doctor, for sharing your view. We have one more viewer with some questions. That is Tina Bhargav. Are there any over-the-counter medications or home remedies that can help elevate symptoms?
Okay. So over the counter medication, the symptom mainly patient will have itching. So they can take some antihistamine so that the itching will get reduced. So the lesion, like when they scratch, when they have itching, once they start scratching on the infected area and they touch the other non-infected area, it might spread. So that's the only thing they can do as a OTC, like over the counter product. They can get some antihistamine for their itching and they can take it, but that doesn't resolve the problem. So once you get the fungal infection, you have to take some antifungal agents to completely cure the disease. So I've seen lots of people like having the infections of chronic fungal infection. So it's not a chronic disease. So you have to, if you get treated, it will get resolved, so that like you can prevent the further infection of other non-infected people also. So I encourage everyone to go and consult a dermatologist to get it treated properly, so that you won't spread the infection to others also.
Okay. All right. Thank you, doctor. Do we find if a person is with obesity or diagnosed with diabetes sweat more, can they lead, or some them they have the symptoms of antifungal infection?
Yes. The fungal infection is more common and it's more severe in those patients, like because it grows in the sweat. When the diabetic level is too high, it grows on the sugar also. So they have to get it controlled, because it's very more severe in the patient who are immunocompromised. That is, their skin immunity is very low. So the patient who are on long-term steroids and who are on immunocompromised patient and immune suppressed patient, who are already like having diabetic, so all those long-term metabolic issues, they have they are more prone to get infected, and they have like the duration of disease is also more compared to other normal people. So they have to get it controlled, their diabetic status, and they have to get it treated.
Okay. What are the basic treatments a person can have it if they are suffering from both of the disease like obesity and diabetes?
So obesity, they have to do diet and exercise to reduce their weight, and diabetic, they have to take anti-diabetic medication depending on their blood sugar level. So they have to get it treated so that the fungal infection will get controlled with the treatment of antifungals.
Okay. Thank you, doctor. We have one more questions from our viewers. That is Shanaya Sen. She has a question. Are there any specific symptoms or signs we should watch out for?
So the symptoms patient will have itchy red rash. So sometimes it will be dry. Usually the lesion will be round. That's why it's called ringworm. So usually it clears in the central area and it spreads in the peripherally. So what you should do is, like, when you apply ointment, usually I instruct the patient to apply the ointment like around the lesion, 2 centimeter beyond the margin. They have to apply the ointment, and they have to take bath twice daily. That's why, like, we say 2S, like we I usually advise a patient to apply the ointment 2 centimeter above the margin, and they have to take bath 2 times daily, and they have to continue applying the ointment once the lesion resolves also, so that there is no reservoir, so the fungus completely gets eradicated. So usually I advise a patient to continue applying the topical antifungal 2 weeks beyond the treatment. So 2 weeks after stopping the oral medication also, they can continue using the topical agent till that lesion completely resolves. Like even the pigmentation also, they will get resolved with this medicines. So usually that's what I advise my patient.
I hope Shanaya Sen has completely gone through the advices what you have given. And we have one more, Sati. Could there be any underlying medical conditions or factors contributing to susceptibility to fungal infection?
So now I feel like if like all of them are getting infected, like through direct contact or through person to person contact, they are getting infection. But the person who are more prone to get infected, or the previously which we are discussing, like diabetic and immunocompromised patient who are on long term immunosuppressive medication, so they are more prone to get the infection. And children who are with low immunity, they'll get the infection.
Okay, all right. So we have Abhishek with us having a questions. Are there any potential side effects or interactions with other medications?
Okay, so depending on the medication what patients are taking, we prescribe antifungal. There is certain interaction with the medication, so they are quite safe. The antifungal which we are prescribing. So usually we ask a patient about the history of medication, what they are taking, if they have any cardiac issue, if they are taking any treatment for that, or if they have any renal issue, they are taking treatment for that. And we, if they are taking some treatment for renal issue, we check their urea and creatinine. We see how what is the level. Depending on that level, we modify the dosage of antifungal that we are giving it. So usually we change all those things, and it's quite safe.
Okay. We have Harshit. Question is, are there any signs that would indicate the need for immediate medical attention or emergency care?
So the superficial fungal infections are not that serious. So, so the signs which they should, like, if the lesion is flourishing, like if they are getting more extensive lesion, if it is spreading very rapidly, they have to consult a dermatologist and see what is the issue. And if they have intense severe itching, so I have seen patients who are getting depressed because of all these issues. So they have to consult a dermatologist and get it treated. Once they see the lesion is extensive and it's spreading rapidly and it's affecting all parts of the body, around 60 to 70% of the body, they have to get it treated. Like that's why I say patients who are getting rash, like tiny rash also, within 4 to 5 days, they have to go and see a doctor and identify whether it's a fungal infection or some other allergy, so that they get treated earlier to prevent the spread of widespread infection.
Doctor, as you mentioned that due to allergy, can you let us know, does allergy of having food allergy or any clothes wearing allergy leads to antifungal infection?
No. The allergies won't lead to fungal infection. Fungal infection is mainly caused by yeast or mold, so it's totally a different organism. So these things can aggravate the itching sensation in the people. So who are atopic child, like allergic condition, who already have some allergic condition, so they'll get a more exaggerated itching sensation. So they'll get more severe infection. So that's what. So it's not related directly. It's totally a different etiology, but patient will have more itchy feel,
Okay.
more symptomatic.
Doctor, do athletics, the sports people, sports individuals, and the housewife working in the kitchen, are the more individuals getting fungal infection?
Yes, yes. The first thing is athletes. So athletes, they wear socks all the time, like most of the time while they are playing it. So the because of the sweating, the fungus grows there. So it forms a medium for the fungus to grow. So they can use a cotton socks, and frequent changing of socks is advised. So one, they can use some absorbent powder to prevent the fungal infection. So they have to take bath immediately after playing. No, like they should
Hmm.
not be with the sweat all the time. They have to change their clothes. So to prevent the infection, they can do that. Once they get infected, they have to get it treated. And for the women who are working in the kitchen, if they are in the water for too long, like wet skin, so they'll be in the water like while washing the dish or while washing their clothes. So they'll be exposed to detergents and all. So they are more prone to get infected because the skin barrier will get disrupted. So frequent washing of their hands and frequently standing in the water for too long, like while washing clothes, they will get infected.
Okay.
So to prevent that, like after washing all using like while using detergent, they can wear gloves, and after washing, they have to keep their skin dry, like not wet. So it should not be wet. So they can keep some towel in the kitchen and dab their hands after washing dishes. So then they have to use a moisturizer, so to bring back their barrier function.
Thank you so much, Doctor. My last question is, what piece of advice would you like to give us for our viewers, the tips and remedies for their daily lifestyle?
Okay, for a healthy lifestyle, they have to, for healthy skin also, they have to take lots of fruits, lots of vegetables, fresh vegetables, and they have to keep hydrated. So they have to drink lots of water, and I believe in exercise, so they have to work out daily. So healthy lifestyles brings healthy skin.
Mhm. And we can avoid more of fungal infections by keeping yourself hygiene. Thank you so much, Dr. Brinda, for your valuable time, and it has been a quite informative session for all our viewers. We look forward for many more such sessions in coming times. Thank you, viewers, for your excellent participation. For more information and updates on skin health care, stay connected on our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you so much. Have a great day ahead and take care of yourself. Thank you,
Thank
viewers.
you.
Thank
Thank
you,
you.
doctor.